So what are the purpose and objectives of KCM? So KCM is a Ccm, which is a structure established by the Global Fund, country coordinating mechanisms is what Ccm is. So the one in Kenya, we call it KCM. So the purpose is constituency engagement. One of the strategic objectives is to engage the various constituencies that receive and benefit funding from the Global Fund, just to see that we are meeting their requirements. We are representing them in decision making. They are able to evaluate and give feedback about how the Global Fund program is being implemented to their members. And so really it's a mechanism, it's a coordinating mechanism to get feedback from the constituencies. We want to strengthen and sustain the Global Fund programming in Kenya, and so we then must get feedback from the ground about our work. So our specific objectives of this engagement forum, so this particular one, we're engaging with you as formal sector because you're one of our constituencies. We want to update you on the KCM Evolution Project. That is a project to update the governance structure of KCM. We want to tell you about the 7th Global Fund replenishment. That is a round of funding globally that funds the Global Fund. We want to tell you about implementation of the grant in our country through the recipients who have received the money and they're here. We want to discuss achievements, challenges, success stories, and we want to discuss the constituency report, or rather our engagement today will contribute towards making a report from formal private sector. So at Global Fund, we are guided in our governance through our mission and vision, our strategy, our principles. We have a strategic plan. And really, we fund the diseases that people call ATM, AIDS, TB, and malaria. We were established in 2002, and we invest $4 billion a year. Our mission is to attract and leverage resources to end the epidemics of HIV, TB, and malaria. You will see in the updates today that the Global Fund has directed some funding to COVID-19 because it was found that COVID-19 is impacting the 3 main diseases that the Global Fund was established for. Our vision is a world free of the burden of HIV, TB, and malaria. So the Global Fund is a financing entity, not an implementing entity. And it exists at the global level and the country level in terms of governance and structure. The functions are resource mobilization and funds disbursements, implementation, monitoring and evaluation, accountability, audit and investigation. As part of accountability, we need to engage constituencies, and your feedback is very important to be captured in the reports that we shall give. So we have strategy 2023 to 2028 that is fighting pandemics and building a healthier and more equitable world. Obviously, this was then was coined because of the strains and stresses that the pandemic brought in the fight against HIV, TB, and malaria. Our key principles are partnerships, country ownership, performance-based funding, and transparency. So that's the Global Fund. How about the KCM? Our vision is optimal, accountable, and transparent stewardship towards ending epidemics of AIDS, TB, and malaria. And in our mission, we want to harness the full potential of partners and resources to fight those same 3 diseases. And so we are aligned with the vision and mission of the Global Fund. And really, as a summary of this slide, we exist to make sure that the funding that Kenya gets really goes to the right recipients and that their feedback is gained in informing the next round of implementation. So we want the fund to be as accountable as possible, the implementers to be as accountable as possible, and even the patients to be accountable in giving their feedback. So our functions as per our written constitution is coordinate approval, endorsement, and submission of funding to the Global Fund, to select the principal recipients, that's a big one for us, through a transparent and documented process. I believe the implementers, the principal recipients who present today will agree that the process was very transparent. To oversee the implementation of activities under the Global Fund approved program, to evaluate the performance of the grants, to ensure linkages between Global Fund assistance and other assistance and programs in line with national priorities. So we need, at the KCM, we need to have a bird's eye view of other funding that is also funding HIV, TB, malaria, and we identify synergies. Even as we evaluate the applications for principal recipients, we need to see that there's linkage and no duplicity in funding and strategies. And then a big one for us, and that's why it's bolded there, is to ensure that the constituencies are involved in decision-making process for the Global Fund grants. How the fund is implemented in Kenya is not determined in Geneva, where the Global Fund is. We are the ones as a KCM who determine and oversight that. We are chaired by the PS of Health. We have a vice chair that's drawn from the NGO constituency. And we have committees. We have a management committee, an ethics committee. We have the secretariat, and members of the secretariat are here, and that gives you an idea of our governance structure. In terms of the KCM membership, drawn from the constituencies, we have the national government, and the representation from national government within the KCM is drawn from the Ministry of Health, NAC, the National AIDS Control Council, the Treasury, KEMRI, and Ministry of Defense. We also have county governments. I think this is I would call it a recent constituent. I believe they've been part of the KCM since maybe the last 4 years. Is that correct? I think they're one of the latest additions. Obviously, because healthcare delivery in Kenya changed to a devolved structure at some point. We have the NGOs, and they have a member. We have FBOs. We have people living with disease. So across the 3 diseases, we have constituencies. We have development partners, both bilaterals and multilaterals. And then we have private sector. And in private sector, we have formal and informal private sector. So KHF sends 1 representative representing formal private sector, and then the informal private sector sends 1 representative. And then we have key populations and adolescents and youth. Now, these are principal members, and then we also have alternates. So every constituency sends, for instance, the national government 5 members and 5 alternates. Private sector 2 members and 2 alternates. So that at any one time, there's high chance of participation in the very many engagement forums and meetings that we have. So our strategic outcomes for the next 5 years is 1, strengthened engagement. So please give us as much feedback as possible in this engagement forum. Effective use of available resources, improved quality of services and grant performance. So there is some funding that comes to the KCM as a KCM, not just, the money doesn't just go to the implementers of the fund. There's also money that comes to KCM to run our operations, and we want to use those funds effectively. And then we want alignment and harmonization in delivery of results. So that's a busy slide. It just shows the achievements so far of the Global Fund in Kenya. And I think what will be more important is for you to hear the actual implementers presenting to you what they've done. Now, I would like to call a little later on somebody from the KCM office to talk about the 7th Global Fund replenishment at the global level and what that means for Kenya. So I'm going to skip this because somebody will come and talk about it. Now, as part of strengthening governance at KCM, we're having what we call the KCM Evolution Project. And we want to be better aligned with national structures in the way we operate. We want to be really focused on investment results. We want to show the Global Fund, you know, a return on investment that is worthwhile for investing in Kenya. And we want to strengthen our governance structure. So what we did is we identified the issues that we were having in Kenya in implementation of the fund and in governance of the KCM. And we gave feedback to the Global Fund because they had sent a consultant to see how better can you run your CCM as Kenya. And we had several meetings, and these are some of the findings that were found. The tenure sometimes is too short of the members, and then there's no traction. So as soon as somebody is a member, Global Fund has so many documents to go through, so many structures to understand, so many engagement forums. By the time you're just getting a grip of it, your term is over and somebody else comes in. And then we found that our constituency engagement meetings were under-resourced, and we need a little bit more funding to the KCM itself. But we also found good things, what is indicated as a plus. The participation is good. The engagement from the different constituencies is very good. We behave like Kenyans on Twitter. We give feedback all the time. We have WhatsApp groups, we have a lot of meetings, and everybody speaks. Whether you're from the smallest constituency or whether you're from the National Treasury, it's a free space, and we found that that's a good thing. We scored highly in that evaluation. And election or selection of membership is well organized and documented. It's not haphazard or ad hoc. So we identified some priority areas, and possibly maybe the one that stands out is the review of the Ccm composition. And these are really activities that we want to do to strengthen the KCM.